Welcome to Security in Minutes, a micro-learning series from Safer Edge, where we introduce or explain a security topic in 2 minutes. Click subscribe to get a new micro-learning in your feed each week. Many of us work in areas where there are no emergency services, or they won't be able to reach our location fast enough in an emergency. In these cases, it is important to know how to assess someone who has an injury or illness. You can use an approach that was developed in the 1980s and has since been adapted for remote care all over the world, called the 5 vital signs. Before you begin the assessment, always make sure you are safe to respond. Then, remember the acronym GO, which stands for Gloves On. Begin to assess the person's vital signs. The first vital sign is response level. Is the person alert? If not, can they respond to your voice? Say by squeezing your hand when asked. If not, they are unresponsive. 2. Breathing. The number of breaths per minute is less important than if their breathing is regular. Does it seem like a lot of effort to breathe? Is it gasping, wheezing, or gurgling? 3. Color. A person's color is related to their temperature. When people are ill or injured, they may become hot or cold. Often this means their skin becomes more red or more pale. Everyone has different skin tones, so you can tell if someone is red or pale by looking at their fingernails or behind their lower lip. 4. Temperature. Normal body temperature is 37 degrees Celsius or 98.6 degrees Fahrenheit. A high temperature is usually a sign of infection or illness. Taking into account the temperature of the environment. Does the person feel hot or cold? 5. Capillaries are a component of our blood circulatory system and how blood circulates throughout our bodies. We measure capillary refill time, because if capillaries do not receive enough blood promptly, it indicates a problem with a person's circulation. Press on the casualty's fingernail for 5 seconds. This causes the blood to flow away from that area. Release after 5 seconds, and the pale patch of skin should be filled with color in less than 2 seconds. If it takes more than 2 seconds for the person's circulation to return to normal, there is a problem. Knowing how to do a vital signs assessment can then help you if you speak to emergency services or a medical professional. It can also help you determine how quickly someone needs to access medical care. If there is any issue with any of these 5 vital signs, means the person needs professional medical care as soon as possible. Safer Edge provides engaging, affordable, on-demand e-learning in multiple languages that can be customized to your organization. Send us an email to learn more.